Welcome to Cutera Experts Corner. In this edition, we'll explore Cutera's truSculpt Flex. According to moderator Dr. Jeffrey Dover of Chestnut Hill, Massachusetts, outside of Boston, the truSculpt Flex is a
fantastic and really revolutionary new technology for toning and increasing the strength of muscles in a variety of different areas, but especially the core.
Dr. Dover kicked off the conversation by asking Dr. Arash Moradzadeh what is unique about the truSculpt Flex device. Here's what Dr. Moradzadeh, a facial plastic surgeon from Beverly Hills, had to say.
The truSculpt Flex is one of my favorite devices in my office, and I have many. And what makes it special is that it's a multidirectional stimulation of the full thickness of the muscles that you choose to target and treat. So that means, for example, if you're treating the abdomen, you have multiple small applicators that you can directly place over the muscles of the abdomen as well as the obliques. And you still have another full set of paddles left to treat a second muscle group. No other device can do that. And because there are 3 different modes, you are able to contract the muscle in different directions as well as with different intensities. So you can do rapid sequence contraction, you can do long sustained contractions. So you're simulating a sort of like a high interval training program, pushing the muscles into aerobic exercise, increasing the person's metabolism for 12 to 14 weeks, and causing an average of 30% increase in muscle mass with a contraction of the overlying fat layer. The boosted metabolism sometimes shows loss of visceral fat. And so while you may just treat the abdomen and see an amazing result there, you're actually getting a total body improvement with your treatment protocol.
Arash, thanks. That's incredibly helpful. Let's go into some very just specific details about this device. Let's first go over the fact that it's direct current, not electromagnetic radiation, which the competitive devices are. And so to the average listener, it's like, what are you talking about? Well, it's very straightforward. Direct current is exactly what it sounds. It's a direct current. There's no magnet in the handpiece. There's no worry about underlying metal, which is crucial. The truth is, if you think about most of my patients who are female, many of them have had laparoscopic surgery, and many have clips that are put in at the time of a tubal ligation or ovarian cyst removal or you name it. Well, those clips are metal, and I don't think you should be using any of the competitive electromagnetic devices when trying to do muscle toning. So that's one huge advantage.
Next, Dr. Dover asked Miami-based dermatologist Dr. Jeremy Green to comment on the number of handpieces available with the truSculpt Flex.
So the Flex has 16 handpieces, which allow you to treat 8 areas simultaneously. And this is very attractive because people don't want to come back. You're already coming back multiple times. So you'd rather get the most bang for your buck, both financially and as well as, with respect to your time. So if you can treat all these areas simultaneously, that's a win-win for your patients.
No, exactly. So let's think of the competition. One paddle can do the belly basically, and that's it. So you sit there for 30 minutes and you get one area done. With the Flex, seeing is believing. We've got 16 of these applicators. So you've used 8 for the belly. You still have another 8 to place, let's say, on the thighs or the hamstrings at the same time. Or you can do the central belly and the obliques instead of just the central belly in 45 minutes, which is virtually painless. It's uncomfortable because of the tension on the muscles, but there's a huge advantage of having direct current, more powerful, and more handpieces to be able to apply all at the same time. Arash, you're the one who taught me about this, and when you first did, I thought, this is too good to be true. And then we got the device. I first had it done with you there. I thought, okay, I'm signing up. And then I started doing it in the practice. Now I can't keep my doctors away from the machine, so it's never available for my patients. What do you think?
I completely agree. I think it's a major advantage to have the multiple hand pieces. Commonly, I'll have patients add on a second muscle group on the day of their first treatment. So that's an added bonus both for the patient as well as for the provider. Or I can do couples. So we do like Valentine's promotions for couples therapy. Husbands and wives can come in together and both of them can treat a targeted muscle group. Mommy daddy makeover after they have a baby. So it really opens up the avenue to have different ways and different protocols that you can do to treat such a large number of areas in a short period of time. And none of that area energy is wasted. All of it's going directly into the muscle that you're targeting. electromagnetic radiation wasn't really designed for this. It's designed for getting to an area that's hard to reach. So if you need to get to the brain and you need to get through the skull, it makes sense. But it doesn't make sense when you're treating a muscle that's just underlying the skin. You don't need to waste that energy and deliver it to the organs and other tissues in the surrounding area.
That's a very good point. I know that some of my patients who are a little skittish say, can't I just start with my belly and see how I do? And the answer is, of course. But then when they come back for the next visit, I say, so what do you think? They say, do the sides or do my thighs. I don't want to waste those 8 because you're already sitting there. It's all during the same 45 minutes. And frankly, it's just doing the belly is no more uncomfortable or less uncomfortable than doing 2 areas, I found, because it sort of gets your mind off one area when one's contracting, the other one's not. Tell us about the discomfort, Jeremy, or how patients tolerate this. I know you've just done a study. Tell us about that.
Patients tolerate it really well. One of the best things I think about the Flex is I think we had 19 patients come through and we didn't have someone that we capped out at. In other words, it's so powerful that we didn't have someone that we said we hit the max and you're not really getting effect. So that's a point that I really wanted to make. But it's uncomfortable in that it tires them out and they feel like they're working out, but it's totally tolerable. And on some level, I think they want to feel like it's doing something. In other words, you don't want to lay there and feel like this is some hocus pocus thing that's a waste of their time. So the fact that they feel these contractions, moving their muscles, I think it's gratifying for the patients.
And what was their feeling after the treatment? Do you think they saw improvement?
In fact, I saw a patient just yesterday. She came back for her neurotoxin treatment, and she said she loved it. She said by her 6th treatment, she was starting to see more of her upper abs. Her husband's a lawyer who's a big runner, and she said she wants to bring him in to do it. But she said she noticed a difference, and the word she used that I loved is she said it was motivating me. So I think something we've seen with body contouring is when patients do something, they invest the time, the money in a procedure, it kind of motivates them as well with their exercise, their lifestyle, their dietary habits. And so, you can't promise somebody's going to have that transformation with it, but it's a nice kick in the pants to get people motivated. So I love that word, motivating.
Dr. Green, thanks for bringing that up. I think it's important for us to emphasize that this is not a weight reduction program. It's not a fat reduction program. And while the device seems to compact fat, it's really for muscle toning, building muscle strength, an average of 30% muscle tone strength increase in a series of treatments. Some patients have more, some people have less, but an average of 30%. But we always recommend a proper healthy diet and healthy regular daily exercise, which could be as little as just walking, because we know being outside is good for your mental health as well as your physical health, but it also will probably give you better results. Now, what's nice about this device is you do not have to be on a special diet or to be a gym rat or to be exercising regularly for this to work, because it works all by itself, sort of in a vacuum. But we always recommend good diet, good exercise. In fact, in our practice, we have a nutritionist sort of on call. She's not in our office, but we hand out her card if patients would like to get a nutritional consultation in conjunction with body contouring. Do either of you recommend that in your practice?
I routinely do nutritional as well as the option of having personal trainers involved in their treatment program and protocols. I think it's important.
I think it's a fantastic idea, Jeff and Arash.
Now, both Jeremy and Arash work in aesthetically concerned parts of the country, Beverly Hills, Southern California, and South Florida, where the prettiest and most fit individuals in the country, probably it's safe to say, live. So you have a captive audience of people who already look good, are pretty fit. Do they need truSculpt Flex? How do you fit it in?
I think there's this huge growing cohort of our society that is looking into body hacks. They're looking at what they can do to take it to the next level. So I think a lot of our patients that are loyal, longtime patients, they've done the body contouring for non-invasive fat removal. They've been satisfied and they want to know what's the next step. And I think the best thing about this device is something that Arash mentioned, is that the layer of fat, they don't have to look like the brochures, that they don't have to have a 12-pack that I've never had in my life to be candidates. So due to this technology, which is unlike any of the competitors, patients of almost any body type, I mean, we're not talking, morbidly obese, but most normal body types are good candidates and will see some benefits with Flex. So I think it's uniquely positioned, and you don't have to be in Beverly Hills or Miami Beach. I think this is something that people all over the country and the world can enjoy because it's safe and they'll feel a difference.
That's so well said. What I often say to patients is, you can have a layer of fat between your skin and your muscle. This device will go right through the fat, right to those muscles and tone those muscles. So even people who don't exercise at all and who are overweight will benefit from this procedure. It is not just for the beautiful gym rats, people who spend all their time looking and toning. It's for regular people, even physicians and nurses who have to work for a living and don't have time to go to the gym regularly. But I have to tell you, my own personal experience is once I started, I didn't want to skip. And we were lining up. I literally, in our office, we had to boot the doctors out and get them off the schedule because the device was never available for our customers, our patients, that is. Arash, what's your experience being in Beverly Hills?
Well, personally, I'm completely addicted to the device, just like you. What it did for me is something that I could never achieve. I always eat healthy and I work out with a trainer 3 to 5 times a week. So I'm as fit as I can possibly be on my own, but genetically it's just not, having nice abs is not an option. All of my family, where everyone's lean, except they tend to hold fat in the area of the abdomen or not develop muscle well in that region. So doing this treatment gave me almost a 6-pack, and that's something that I'm shocked that is now a possibility for me, and it made me very happy. But it also makes all of my patients very happy. So I have a very big audience who's interested, who already have really nice bodies and want to enhance them further, but also those with normal bodies who are doing it for aesthetic reasons, as well as to try to get them past that plateau when they're having trouble getting more results in the gym or losing weight. And this has become an adjunct that's really catapulting them. With that increase in metabolism, they're seeing that switch kind of turn on, their body turns on, and it's going so much further. And then the motivating effect that that has on them in the rest of their life is pretty impressive.
Thank you both. Let's switch gears and talk a bit about the actual protocol itself. So a Rush patient comes in and they're totally normal individuals. They work out once or twice a week, walk, eat, and they're near ideal body weight, but they hear about Flex and say, how do I do it and how do I start? So what do you recommend?
Yeah, so in the patient that you just described, I'll commonly discuss with them having a 4-treatment protocol where they have the first 2 treatments are using the tone mode, which is going to be those long sustained contractions. And the last 15 minutes of each of those is actually a kind of a preview of the sculpt mode, which is going to be the rapid sequence contractions. So 2 tone modes followed by 2 sculpt modes, commonly done over a 2-week period and never 2 days in a row. And I usually recommend not doing it during your menstrual cycle because those cramps can increase the discomfort of the treatment. And so that will be my starting point. And then after that comes in the maintenance programs, which start at the 12-week mark. Commonly, patients will do it once a month, and then I have others who will do it once every 2 months, and then the other group that does it once every 3 months. So it's kind of like 3 types of maintenance based on their budget as well as their goals. And then for those who have not exercised much, I throw in 2 prep modes at the beginning. So then they do a 6-treatment protocol with 2 prep modes, 2 tone modes, followed by the 2 sculpt modes at the end.
So either they do 6 in the first 3 weeks or 4 in the first 2 weeks, depending on whether they're fit or not. And then you go to maintenance, which is every month, 2 months, or 3 months, and you hit the nail on the head based on their goals and their budget. So Jeremy, let's say a patient has done their 6 and they love it and say, can I come every week? What do you say? They say, money's not the issue. I want to look my best. I really like what this has done, but I want to get even stronger. And now I want to do my thighs and my glutes. What do you say?
I say, will you marry me? I want to stop working and sit on the flex every week also. Yeah, I mean, in my mind, it's totally safe. I'd be curious, Arash has more clinical experience than I do, but in my mind, weekly treatments like lasers, they're safe if they're not aggressive treatments that are really causing trauma or damage that your body needs to recover from. I think it's totally reasonable.
No, exactly. So we feel the same way. And in fact, the maintenance program it's empiric. It's not based on scientific data that shows if you don't do it every 8 weeks, you're going to lose everything. But everybody on this call and everybody listening knows if you don't exercise, you lose muscle mass. So you either go for a walk or go to the gym or do flex. And so when patients say, well, how often shall I do it? I say, you tell me what you'd like to do. I recommend every month, 2 months, or 3 months. You decide whatever suits your budget. But I think maintenance is crucial, unlike with truSculpt ID where you get permanent fat loss. This is not permanent muscle toning or muscle mass increase. So you must do maintenance, whether it's every 4 weeks, 8 weeks, or 12 weeks. I personally think continuing and doing it twice a week forever is probably unnecessary, but I have patients who want to do that, and I have colleagues, literally my colleagues, who will not skip an appointment. They wait till 8 at night till the device is available so they can do a treatment because they get hooked on it. And I don't know if it's physically addicting, but it's emotionally addicting. You want to actually go and have it done. So I think it's a great answer. Like, why not? But it's a budgetary issue, not a safety issue. I don't think patients will get overtoned and get hypertrophic. That's never been seen. Arash, have you seen anybody who's overdone it?
I have never seen a single complication or issue using this device. If you apply it correctly, it's very safe and you can treat once a week without any kind of problem. And I think that really highlights the strength of this device over the electromagnetic radiation. I had electromagnetic radiation treatment on myself, the 4-treatment protocol. And by the 4th treatment, I was at 99% on that device, meaning that I had already maxed out on what it could do for me. You are not going to max out on truSculpt Flex. It's very powerful because all of the energy is being delivered directly into your muscle. Your muscles are not going to reach 98%. Your tolerance will build over time, but you're not going to reach that plateau and max out with it. So you have room to do once weekly treatments and see more results.
I think that's a very important point. 2 points here. One, the device is very easy to learn how to use. So we actually have our research associates, also registered nurses doing this, but even I learned how to do it, and after 1 treatment, I could do it myself. It's not the most fun thing to do to yourself because it's a little uncomfortable, so I prefer having someone else put it on. It's a little tricky to put on yourself, although it can be done, but it's easy to learn to do. There's a technique to do it, but as you both said, if it's done safely, it's very effective and safe and very straightforward to learn how to use, and it's very hard to max out because it's so powerful. And our experience with the competitive devices is they worked fine, but none of our staff who had both done felt that they got maximum input from the other devices, whereas this one, they could not even reach 50% capacity, and it was like, that was all they could reach. We have had a couple of study patients get into the 90% range, but very, very few. Of course, women who were really motivated and semi-professional athletes who were very toned. But the average normal person was at 25 to 35%. They were nowhere near the max capacity. So this device is a device that keeps giving, and I think it's important to know that it's safe. Let's talk about one last thing before we wrap up. Perhaps both of you could talk about this concept of, as we age, our metabolism decreases, right? Our muscle mass decreases, and we become less fit and we get more visceral fat. So how does Flex help here? Jeremy, maybe you could start.
Well, I think Flex has been shown, it's just very similar to working out as far as you're causing this micro trauma to the muscle, which is causing the muscle to repair itself and subsequently hypertrophy. And during this whole time, you're also kickstarting your metabolism. So even though it can't be any sort of thing that we claim, or I wouldn't even say to patients that it's going to happen, is there has been some anecdotal reports of reduced visceral fat, some fat reduction, that you are getting these metabolic effects downstream that maybe we wouldn't have thought were possible with a muscle strengthening device. So yes, I mean, women have a more precipitous decline, perhaps in their late 40s or 50s, but men also have a more linear decline, which they call menopause, where, you know, we lose about, I think it's about 1% testosterone per year, you know, starting at 30, something like that, where we're on this slower slope downward. And so this is a way that you can treat both men and women effectively in your practice.
And to add to that great comment, of any age. So 70-year-olds, to me, that's the sweet spot. Like, why are we not treating 16, 17-year-olds? They're the ones who need the muscle mass. So,
Yes.
I agree
And
with you.
you know, Jeff, as you know, my father is a neurosurgeon, and he's always, and I know you're going to speak a little bit more about functional downstream, but he's always harping on Pilates because he loves what it can do for strengthening core. So I think we can't underestimate the other benefits of strengthening
And he's
erectus
one of the
abdominis.
smartest people I know. And so when Bart Green talks, I always listen, and that's why he's able to keep going and going and going, the ever-ready battery man, because he tones and keeps his body and his mind fit. So thank you for sharing that. Arash, tell us about your thoughts about this for metabolism and visceral fat, because I think this is a really important way to close.
Yeah, I actually think it's one of the huge benefits of this treatment. I see that most of my patients, starting from their second tone mode treatment, start to see a real kick in their metabolism. And if they have been dieting and exercising simultaneously, they will see in the first week usually a 5 to 7 pound weight drop. And then that continues along for the next 12 to 14 weeks with about average of 15-pound weight loss total from just doing their flex treatments. And those are in my more motivated categories. And then there are those who are genetically predisposed to having their metabolism really skyrocket from this treatment. They see up to 25 pounds weight loss. And then in those, some of the others with a slower metabolism, I'm seeing about 5 to 7 pound weight loss. But that metabolism is real. It really does go up. If you pair it with a diet program and an exercise program simultaneously, you will see even more dramatic results. And then also the visceral fat. The first time I treated a guy with a more protruded abdomen, I told him, while we can kind of treat your muscle and get it more toned, there's going to be an issue because of that visceral fat that you have there. So your abdomen is still going to project. To my surprise, the visceral fat really melted away dramatically. And that's because there is a relationship between building muscle and burning fat. So as you build muscle, you have a tendency to burn fat. And we know that the visceral fat only responds to diet and exercise. And you're getting a simulation of that with this treatment. So we are seeing substantial visceral fat reduction.
Yeah, this is incredibly important and something that the company and we are going to study, looking at visceral fat loss from this muscle toning procedure. At first glance, you think, what are you talking about? That makes no sense. But Arash, you explained it perfectly well. You're burning fat and you're building muscle at the same time. And you're burning the fat because you're inducing this aerobic catabolic state towards the end of these treatments. I want to thank you both very much. What I'd like to do before we close, though, is ask if you have any just final brief comments for our listeners. Let's start with Jeremy.
So I guess for me, one thing I've learned in being an aesthetic since I was your fellow back in 2010 is that first doesn't necessarily mean it's best. So when it came to picosecond lasers, there was a laser that came out first, and I was with Dr. Brandt. We wanted to have the latest and the best technology. We always wanted to have it right away. But we waited for the dust to settle and for some other manufacturers to come out with their products. And we ended up choosing the Cutera Enlighten, and we were thrilled with it. And in retrospect, we made the right decision. And so this is a bit of history repeating itself within our practice, where there's so much buzz about this muscle strengthening technology. And we were so eager to jump on, but we didn't want to get the same one that was down the block from us that 3 different people had. So we waited, we were patient, we waited till other competitors came out. The dust settled, we evaluated the landscape, and we're thrilled that we ended up adopting the Flex within our practice. So it's just a lesson from our experience.
Jeremy, thank you very much for those thoughtful comments. Arash?
So my lesson is always don't judge a book by its cover. You'll be very surprised at who actually wants to have this treatment. Everyone that comes to your practice is a truSculpt Flex candidate. And almost everyone that comes to your practice actually has an interest in it. They just may not know about it. So once they see it and once they're presented it and they see all the different things that it can do for them, both functionally, cosmetically, and overall health, they will want to do it and they will want to come back and do more areas over time.
Well, thank you. My final comment is that when I first heard about muscle toning, I thought, what's a dermatologist doing, even thinking about, let alone talking about muscle toning? It's not in our sweet spot. This is a far cry from what I've been trained to do and what I do, number one. Number two, I think it's bogus and probably doesn't work. And so I belittled it. And I belittled it until the truSculpt Flex came out with the multiple heads, 16 paddles or 16 applicators, 8 areas treated per time, with unbelievable power.
Dr. Dover closed with a powerful analogy.
You don't want a car that's flat out at 60. What do you do when you have to go to pass? So you've got to have something extra in the tank, and that's what's nice with this Flex is it's a very powerful, incredibly giving device, which is safe.
If you haven't listened to other episodes in the Cutera Experts Corner series, listen now. And be sure to listen to other new episodes focused on the truSculpt Flex. You can learn more by visiting Cutera.com. Thanks for listening.